Alright, hey guys, it's Dr. Connor Nakarado here with Physio Strength Physical Therapy, and what we're going to be talking about today, or looking at today, is how diaphragmatic breathing works, right? So we're going to go ahead and just hide this. So as you can see, right, so we've got the lungs in through here, we've got all your intercostal muscles, so these are these guys in between the ribs, right? So this is your diaphragm, this giant structure down here. So that's just half of the diaphragm. If we can do a multi-selection, that's both sides of the diaphragm. So as you can see from bottom view, the diaphragm kind of supports all your organs, right? So you've got organs underneath here, right? And then above here, you've got kind of your heart and lungs, things like that. And then down through here, you'll have your intestines, your stomach, everything else. So what the diaphragm does is when the diaphragm contracts, it pulls down this way and it creates a negative pressure inside the lungs that brings air in through your mouth, down your respiratory system, and into the lungs to fill everything up. Now, when you're not using diaphragmatic breathing, you're not getting that full negative pressure. And a lot of times what happens is when we don't use that diaphragmatic breathing pattern, we start to use these muscles up through here in the neck, right? And that can cause neck pain, tightness. If you notice that these muscles, like your upper traps, muscles in your front of your neck, your scalenes, even your pecs are getting really tight, that's because those are accessory breathing muscles, right? So see how this pec minor muscle comes in and attached to the ribs? That helps you with your breathing. So that's a really good function for, when you're running and you're out of breath or you're sprinting and you need that extra pull of the ribs. But in everyday life, we should really be breathing more through the diaphragm. And the main reason for that is because it helps improve gas exchange, right? So if we take away some layers here and we just look at the lungs, we can add in the arteries here. So think of gravity here. So as we get blood in through the lungs, a lot of that blood is going to be pulled down through here, right? So what we need to do to get a good gas exchange is really get the air that you're breathing in from up here to come all the way down to the bottom of the lungs, because that's where you are going to get the most bang for your buck, right? You're going to get the most gas exchange down at the bottom of the lungs, because that diaphragm, when that diaphragm works, it helps create that negative pressure, pulls the air all the way in through here, which is where most of the blood is, and that way you can transfer that oxygen into the blood through there. When you're not using your diaphragm to breathe, a lot of times air's only getting in through this upper lobe of the lung, really up through here. So, the important thing with diaphragmatic breathing, there's a number of ways to kind of practice that technique, things like that, and I'll have some other links to different videos through that. You can also find them on our Instagram at PhysioStrength. But the important thing is really, taking the time to practice diaphragmatic breathing and taking the time to, try to let your accessory breathing muscles, which are these ones up through your neck, again, your pecs, your scalenes, things like that, to let those muscles kind of relax and really try to do that work from the belly, right? That diaphragm, take a look at that again, take off a couple layers. That diaphragm down here should be doing most of the work, right? So that's the muscle that's really gonna help create that pull, get the air in from all the way up the top, all the way down to the bottom of the lungs, where you're gonna get that really good gas exchange. All right, thanks guys. Thanks for watching. Feel free to check out our website at www.physiostrength.com. Follow us on Instagram for different exercises, and we will post a diaphragmatic breathing one here soon. Thanks.